So I'm just going to pick up from where I just left off. So we were talking about Alzheimer's disease. I just want to kind of re-explain some things. So again, Alzheimer's disease accounts for 60 to 80% of all dementia cases. Now, earlier I mentioned the greatest risk factor is aging. And I do want to mention that this does not mean that all older adults obtain Alzheimer's disease. What I mean to say is that the majority of people that have Alzheimer's disease are older than 60 years old. So aging is associated with an increased proclivity to obtain Alzheimer's disease. And I mentioned that Alzheimer's disease affects episodic memory. So we saw there's this atrophy of the hippocampus. You can see this progression of Alzheimer's disease in normal brain to severe Alzheimer's disease, that we're seeing loss in gray matter tissue. Gray matter being the neural structures like the hippocampus. And later, though, it also affects aspects of working memory or short-term memory. And so all this is illustrated. So we've shown here with Alzheimer's disease, we saw it with Korsakoff syndrome, and we also saw it with case studies like that of patient HM, that episodic memory seems to be particularly vulnerable to loss or forgetting. But what about our other types of systems of memory, and what neural structures underlie those? And to begin, let's look a little bit at procedural memory. So whereas episodic memory relies on the hippocampus and associated structures, procedural memory is based in the basal ganglia, a different collection of neural structures. Now, these are actually anatomically quite close to the hippocampus. So the hippocampus would actually be slightly, would be around here in the medial temporal lobe. But the basal ganglia are a different set of structures, which include the striatum. And so the striatum is heavily involved in procedural memory. And so oftentimes procedural memory or procedural-based learning is referred to as striatal-dependent learning. So learning that occurs in the striatum. Now, if you've taken a class on reward, you'll also note that the basal ganglia, which include, again, these collections of structures in the brain, are also involved in dopaminergic pathways. And dopamine is a neurotransmitter which plays a heavy role in reward, has positive, often euphoric experiences. It incentivizes organisms to seek out rewards or seek out things that give the organism pleasure. And so dopamine is intimately connected to the same structures that underlie procedural memory. So here's just a figure to illustrate that. So in this figure, the blue pathways, these blue arrows, represent dopaminergic pathways or dopamine projections that originate in structures of the basal ganglia. So one origin is the substantia nigra, and another one is the VTA, the ventral tegmentum area. And we're not going to concern ourselves here with the VTA. Actually, we're going to focus on this substantia nigra, a subregion of the basal ganglia, which have dopaminergic projections to other regions like the thalamus. And the reason we're going to draw our attention to substantia nigra is because it is affected in Parkinson's disease, which, like Alzheimer's disease, is a neurodegenerative disorder or neurodegenerative disease. But in this case, it's depleting dopaminergic neurons in the basal ganglia, and particularly in the substantia nigra. So you can see here, here's an illustration of a normal substantia nigra, and these darkened regions are dopamine neurons. And these dopamine neurons deplete, or they're diminished in Parkinson's disease patients. And what we observe with patients with PD is that they have procedural motor memory impairments. So they have an impaired ability to walk, they have an impaired ability to drive, they also have an impaired ability to carry out new or relatively less commonly encountered types of procedural memory. So if you ask a patient with Parkinson's disease to walk backwards, they're going to have a much more challenging time doing that than you or I would do. And I would note walking backwards is certainly harder than walking forward, in part because we do it less often, but it's especially complicated for patients with Parkinson's disease. And so these findings suggest that dopamine plays an important role in procedural memories because a depletion of dopamine and structures that are also related to procedural memory, so the substantia nigra, a depletion of dopamine is associated also with this impaired ability to carry out procedural memories. Finally, we'll talk about what neural structures underlie working memory, and we'll go in a lot more depth into working memory in the next set of lectures. But working memory tends to rely on structures referred to as the prefrontal cortex. So as its name implies, these are parts of the brain that lie towards the front end of the brain. And so here's a simple illustration of a working memory task. So a participant is shown some target item to remember. And as they're encoding that item, there's activation, shown here in blue, in the prefrontal cortex. Next, some time passes, a delay period, during which the target is no longer presented to the participant, but they have to keep it in mind, so they have to maintain it in memory. Maybe they have to do some type of manipulation, either on the object or maybe some other task. All of this is still relying on the prefrontal cortex. Finally, they're shown a probe, an object, for example, and they have to say, is this the same object that I saw here? So is this probe the target? And again, this decision is relying on this prefrontal cortex. So in all cases, the prefrontal cortex is involved in the encoding, maintenance, and then selection of information from working memory. And the prefrontal cortex is more developed in humans than in any other species, and also more matured in adulthood than in childhood or adolescence. So next time we'll go into more depth about working memory, so see you all then.